Buckle up for a new episode of Bump-a-holics, the one and only podcast made to teach on all stages of the arrival of a baby, before, during, and after. Whether you're an expecting mother, have questions about fertility, difficulty with lactation, or postpartum, you're sure to learn from our experienced doulas when you listen to Bump-a-holics.
Today, we are going to dive into pregnancy week 15 with me, Brittany. So join us in the comment section for any questions that you have. I'd love to hear them and answer them in the next video. Welcome to another episode of the Trimester Journey. I'm Brittany Brownell, certified birth and bereavement doula, certified birth photographer, director, and volunteer with Casey Women's Ministry, mother of 3, soon to be mother of 4.
The following media content is intended to only be an educational reference guide and should not be taken as a substitute for medical advice. While Casey Women's Ministry adheres to strict, self-set guidelines, any advice, instructions, or information found within this media is not intended to be a substitute for medical advice, diagnosis, or treatment. KCWM makes every effort to broadcast correct information. We simply present the views based on evidence-based information. We welcome any comments, suggestions, or correction of errors. We are not sponsored by drug or device companies. By listening or viewing this podcast, you agree not to use this podcast as medical advice to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast. Under no circumstances shall Casey Women's Ministry, any guests or contributors to the podcast, or any employees, associates, or affiliates of Casey Women's Ministry be responsible for damages arising from the use of the podcast. Viewer discretion is advised.
All right, we have made it to week 15, guys. So last week I mentioned some dizzy spells. That is because our pregnant bodies are circulating more blood than when we weren't pregnant. The total blood volume increase, it kind of varies from person to person, individual to individual. It goes between 20 to even up to 100%. But the average increase is about 45 to 50% of blood volume when you are pregnant. So that's a pretty big increase of blood volume. If you're getting dizzy or winded, your body is having to work a little harder to pump that blood and oxygenate all of its organs due to a higher blood volume. So as our body makes sure that there is enough blood to flow to all of our parts, all of our organs, all of our muscles, our lovely mucous membranes also get an increase. Yay! So that means there's more swelling in our nose and sinus cavities. And we might get some stuffiness and some drainage. Don't worry, you're most likely not sick unless you add a few extra things to it. But it's just a lovely pregnancy symptom. It's a fun one because then we get those looks of you're out and about and you're coughing and sneezing and you're like, I'm pregnant. What are you gonna do? So yeah, that's always fun. Another result means a stronger allergy reaction. Especially when you have seasonal allergies or food allergies, you might show stronger symptoms than you normally would when you weren't pregnant. So you could do some saline nasal sprays, some allergy medications, use those types of things to reduce stuffiness. Double check which ones are safe during pregnancy with your provider if your provider hasn't already given you a list of safe medications that you can take. I don't take a whole lot of medications myself. I usually just do Benadryl, but I have an allergic reaction to most medications. So that's always fun. And let's see, I also have a sensitivity to eggs, which has been increased through my pregnancy. Instead of just having some inflammation problems, now I'm getting nausea with it. So that's always fun too. But otherwise, you might see some changes with your allergies and your sensitivities. Are you starting to glow? Get that pregnancy glow that everyone always talks about? I see some glow on my face, but I'm betting it's because I have the window open. But anyway, that glow that you're getting, it's hormones that are also causing those mood swings, but it makes your skin look brighter and more glowy because it's brighter. It's partly the increased blood flow, which makes your cheeks kind of flush. They're a little more pink than they might be. And then, you just have your overall happiness of being pregnant and bringing a new life into the world. Yeah, it can be tiring, but it's also beautiful and magical, especially as you start feeling those little flutters from the baby. Um, yeah, it makes you happy. So, I mean, you might have some mixed feelings about it. I totally get that. But yeah. So as our baby grows, so does our bump. We're getting a larger tummy. I actually had to pull out some maternity clothes this week because my pants are getting a little tight and I can no longer button my normal jeans. Yeah, I've got some maternity leggings on order because that's pretty much all I wear. I wear a bunch of leggings. I don't even really wear jeans around the house much, but I ordered some maternity leggings because my normal leggings are also getting tight. And it's not very fun when you're walking around and you got this big old pressure in the middle of your abdomen. And then it just makes you look kind of not pregnant and weirdly proportioned. So I'm one of the ones that I like the pregnancy pants that go up over my stomach. A lot of people don't like those, and that's okay. You might have some sensitive skin. Maybe your skin's itchy, or it's sensitive to the touch because it's expanding and it hasn't done that before. Maybe you don't want anything touching it. That's okay. They have pants that go under the belly, which are great. I like the ones that go over. All right, so time for some fun stuff. How big is our baby this week? So baby is about 6.5 inches long and around 2.5 ounces. It's approximately the size of an avocado. That's double the size of last week. That's crazy. All right, so each week, our little baby is starting to look more and more like a little person. It's amazing. I love it. Baby's eyes are moving more toward the center of the head because they kind of look like fish eyes on the side of the head as they start to develop. But now they're moving more toward the front. And their little ears are starting to move more toward the back where they're supposed to be on the side of the head. Baby's getting more proportional as the arms and legs lengthen. When they first start, they're mainly just a body and a head, and they look really weird. But now they're starting to get arms and get legs and look like a little person inside there. They still look a little strange. If baby comes out, it's not going to be what you expect. Baby's not going to look quite what you might expect, but they are looking more and more like a person every week. Some extra things are also functioning, like the joints. Baby can actually move their arms and legs. They can go up and down, in and out. So it's really amazing because all of this happens so quickly. It's like, well, if baby's like a fully formed person by the X number of weeks, why can't they just come out? Well, they just have to put on fat and do the final touches on a lot of that growth. So baby's heart is still developing, but it is actually still pumping. It's actually pumping about 25 quarts of blood a day. That's a lot of blood for this little itty thing. The lungs are developing and baby's practicing breathing that amniotic fluid, which you might think is gross because but anyway, it's all sterile. So we've got a lot of development happening with baby this week. It's really neat. All right, so nutrition wise, look for lean meats, look for cooked seafood. All of these things are going to give you plenty of protein. They're going to help keep you full longer, help you feel more satiated. Leafy greens, vegetables, beans, lentils, those are rich in iron and protein. And those are some nutrients that you really need that help build that baby up. I tend to get hungry mid-morning and once or twice in the afternoon. So nuts make great snacks. Veggies make great snacks. Whole grains, veggies, and fruits also give you a good amount of fiber so that we don't get as constipated because it's still a thing. All of that, all of our system there, digestive system is the word I'm looking for. All of that system has slowed down in order to really pull out as many nutrients as possible from the foods that we've eaten. So it can get backed up in there a little bit, and making sure we have plenty of foods with fiber and things that help keep you flowing really helps keep you regular and comfortable, because that's a lot of extra pressure on top of baby. So I don't really have a whole lot of next steps this time. Now, and, just your typical when to call your provider if you have concerns or questions, if you're bleeding a lot or you have a lot of pain somewhere. But otherwise, enjoy your time and enjoy your pregnancy. So ta-ta for now. I'll see you next week. Oh, well, actually, I should. Yeah, I really hope you enjoyed my episode. Wow, I got way off topic here, which is why I keep a few notes at the bottom. But anyway, this episode of Bump-a-holics, I hope you enjoyed it. You can find more information on the ministry at kcwomensministry.org. Thank you so much for joining me today for this episode of the Trimester Journey in Bump-a-holics. It's available on YouTube or wherever you get your podcasts. We have them uploaded to many podcast websites. If you haven't already, send me a comment. Let me know what your thoughts are. Let me know how your pregnancy is going. What symptoms are you experiencing right now? Make sure you give me a comment, subscribe so you don't miss any future episodes. I'm going to do an episode every week about pregnancy, a week-by-week pregnancy. You get to follow pregnancy with me and this baby bump. Whoop, whoop. So sorry, my shirt's a little crooked, but we love having you here. I post it every week. So come see me again next week.